people die as a result of raised blood pressure. It's the single biggest contributor to death around the world. It can cause cardiovascular diseases such as heart attacks, strokes, and kidney problems. What's more frightening is that it's a silent killer. More than half of the people who have high blood pressure don't even know that they've got it because there are usually no symptoms, so they don't seek treatment. But simple lifestyle changes or prescribed medication can have an immediate and positive impact on your blood pressure. So the easiest way to save lives is to get people to measure their blood pressure, so more people can get treatment. High blood pressure can affect anyone. If you're over 18, get yours checked.
So high blood pressure, medically known as hypertension, is called the silent killer. Approximately 4 in 10 adults over the age of 25 have hypertension. This means that nearly 1 billion people have hypertension. The unfortunate part is that over 50% of these people are unaware of the condition. Of those who are aware, half of them do not take any action to control their blood pressure, either through lifestyle modification or medication. Now, this means that 75% of the world's hypertensive population are at risk and are potential candidates for heart disease, strokes, kidney disease, or even sudden death. Now, World Hypertension Day is celebrated on the 17th of May, and the theme is Know Your Numbers. Now, we discuss hypertension today. We'll be joined in studio by a cardiologist, and then the president and advisory board member of the South African Hypertension Society, someone living with hypertension. And joining us from our Pretoria studio is the Director of Non-Communicable Diseases from the National Department of Health. Now, be part of this show by asking the panel some questions or simply just sharing your views with us. The number to call is Johannesburg 714-5861 or 5877. You can tweet us at SABC Health Talk or just interact with us on our Facebook page, SABC Health Talk. Sit back, relax, and learn from this bumper show coming to you just after a short break. I'm Dr. Salome Daung, and this is Health Talk.
As part of Africa, we're giving its people the great future it deserves with an investment partner like no other, you. We've invested 120 billion rands of our money and yours into creating more than just hope for this beautiful continent we call home. We're sustaining our soil and enriching lives. We're giving our children a brighter tomorrow. We're investing in small businesses to grow the economy. And we're bringing warmth and light to the people who need it most. And by investing in our planet, we're passing this all on to future generations too. Great things are possible when we invest together. That's why we're invested in changing Africa's tomorrow.
On Network, we have gadgets, robots, and more.
I just hacked the drone and now I have full control of it. I can fly it, I can get all kinds of data back.
A lot of people nowadays plan their travels based on what they see on hashtag #InstaTravel.
Basically, with the use of your smartphone, you are able to navigate your way in and across the length and breadth of our majestic country.
There's technology and social media news on Network at 8:30 p.m. and every Sunday at 5:30 p.m.
$10 million people die each year from consequences of high blood pressure. The Hypertension Society, together with the Department of Health, are joining forces against the silent killer. While people were getting tested, we asked them why do they think it is important for people to get out there and get tested.
The importance of checking your high blood pressure is just to make sure that you don't have related high blood pressure conditions like stroke and others, because you can't really tell whether you've got high blood pressure or not. It's not like a cold or a flu. So it's something that could suddenly kill you. I mean, I've seen it with my family. My dad also died from high blood pressure. He had a stroke. So it's just really important for you to constantly check, and also to check your lifestyle. What are you eating? Are you exercising? It doesn't have to be like extreme ends of exercising, but really just living a healthy life. Get away from magwin.
Well, apparently in South Africa, 1 in 2 South Africans have high blood pressure, and South Africa apparently has the highest blood pressure, so it is quite a concern. It's good to know your blood pressure. If you have high or low blood pressure, it's good to be aware of your health.
Because it's important for everyone to know their blood pressure. So I think this May Measurement Month is actually a very good idea for everyone to be aware of their status for this condition.
Well, I personally actually suffer from low blood pressure, and I do a lot of sports, so I like to make sure that, I'm in my best possible health, so I always check my blood pressure.
It's a silent killer because it doesn't have any signs and symptoms. And the problems are, if you don't manage high blood pressure, you end up with strokes, myocardial infarction or heart attacks, heart failure, kidney failure, and it's so easy to treat and manage by just taking one, and obviously if it's very high blood pressure, more than one tablet a day.
Well, I just learned for the very first time that it's the number one killer, so that alone should be a reason. Also, there's no way of knowing unless you get it tested.
Each May, volunteers around the world measure the blood pressure of people in cities, towns and villages as part of the May Measurement Month. All participants leave knowing their blood pressure, and anyone who registered as hypertensive is given advice about what they need to do next. Do the right thing and get tested.
All right, so let's learn more about this condition called hypertension. It's a great pleasure to introduce our guest. First up is Dr. Musa Mayayise. Now, Dr. Mayayise is a specialist cardiologist who practices out in Pretoria and at a hospital called Butsilo out in Soshanguve. Welcome to Health Talk, Dr. Mayayise.
Thank you very much.
All right, and next to Dr. Mayayise, we have Dr. Martin Mbe, no stranger to this show. Dr. Martin Mbe is the president and advisory board member of the South African Hypertension Society. Welcome to Health Talk, Dr. Mbe.
Thanks for having me.
All right. And in our Pretoria studio, we have Sandhya Singh. Sandhya is the director for NCDs, as we call them, or Non-Communicable Diseases, from the National Department of Health. Welcome to Health Talk, Sandhya.
Good morning. Good morning to your experts as well as your viewers.
All right. We're going to come back to you just now. Let's start with Dr. Mayayise here in Johannesburg. Dr. Mayayise, we're talking hypertension. I know most people would know roughly what hypertension is, but just for the sake of everybody else, what is hypertension?
Okay, thank you for asking. From my side, I think I'll start as a cardiologist. What do we have to transport blood into the tissues? Because that's what we're dealing with. So we've got the heart, which is the pump, which generates pressure, and then the blood goes and then reaches the tissues where it's supposed to go. So in other words, we need the pressure, to be able to move the blood into the tissues where it's supposed to go. So now it becomes a problem when the blood pressure is high. I can give an example. Let's say we are in a house and then want to get water into the tap. Then there will be a pressure pump, and then there will be this pipe that's going to take water in, and then the pressure pump is going to generate pressure, and then it's going to push the water into the tap which you want. Now that is good. So the problem becomes when the blood pressure is too high.
All right, before we get there, then there's this concept of normal pressure and high blood pressure. So how then do we define, we say to people, know your numbers. How do we define high blood pressure?
Okay, so now we now know that if blood pressure goes above 120/80, there start to be problems. And then if it's below 120/80, everybody's happy. Doesn't matter whether you're from Europe, you're from America, everybody's happy. Then the problem comes when you rise above 120. So if it goes between 120 to 129, it starts to be slightly high. 130, 139, they call it high normal. And then the Americans are starting to call it hypertension, which is becoming a bit of a problem. Above 140/90, everybody agrees that is a high blood pressure.
So is that what people should then know? That
yes,
I mustn't get to that level of 140/90 because then I have hypertension.
100%.
All right. Dr. Mbe, how much, the level of awareness amongst our community, because, in the stats that I shared, I alluded to the fact that, more than 50% of people are walking around with hypertension, not knowing that they have the condition. What's the level of awareness like in our communities?
Yeah, the ballpark figure you came up with indicating that about 50% of individuals with hypertension are not even aware that they are hypertensive. It's actually a conservative estimate. Data published in around 2017 on statistics from sub-Saharan Africa actually reflects that up to 73% of individuals with hypertension are not even aware that they are hypertensive. It even gets worse. Of the ones that are aware that they are hypertensive only half are on treatment. So we tend to assume that the ones who are on treatment have a low risk.
Right.
But then if you look closer at the statistics of the ones who are on treatment, half of them are actually controlled. So taking pills and your blood pressure is not coming down, you are the same as somebody who's not taking pills because the consequence is the same. So our levels
so
of
effectively
control...
only treating about 25% of people.
And we control only 6% of the hypertensive population. That's very dismal.
That's scary, isn't it?
That's very scary because a lot of people think that taking treatment means you are controlled.
Right.
And being controlled, that's why we preach know your numbers.
Right.
If you know what your numbers should be, then you know even when you are taking treatment whether you are attaining the numbers that you need to or not. Because if it remains above 140/90, it's as good as drinking water, really.
Okay, so tell us about this concept of May Measurement Month. What is that and what's the involvement of your society?
Yeah, May Measurement Month is an initiative by the International Society of Hypertension. It's actually a global cross-sectional survey which is conducted during the month of May. This is to have more robust data on the true prevalence of hypertension, the number of people that are treated, the numbers that are controlled and so forth. And for those ones who are found to be hypertensive, they'll be given some advice on lifestyle modification, and then they'll be referred to a center where they can be treated. So South African Hypertension Society is an affiliate of the International Society of Hypertension, and we are participating in that survey. So this is in its third year. It was first started in 2017, then 2018, now 2019. We're in our third year. And what we decided to do this year to boost the numbers that are going to be screened is to team up with the National Department of Health.
Talk about the National Department of Health. Perhaps it's an opportune time for us to cross over to Pretoria studio and speak to Sandhya Singh. Sandhya, you've heard the discussions that we've had so far on hypertension. And from the department's perspective, I mean, clearly this is a problem. How are we dealing with it as a department?
Well, thank you very much. You would have heard many times the Minister speaks about the quadruple burden of disease, which includes HIV, TB, high maternal child mortality, NCDs, trauma and injury. While hypertension is part of NCDs, hypertension also falls part of comorbidities with other conditions, and that's a very serious problem for the department. What we have realized is that just wanting to create awareness, which is very important, is not enough. Government has to take a firm hand on addressing the commercial determinants of health. And hence our actions in terms of the Minister signing a regulation in 2012 to reduce the content of salt in certain foods, and as well as last year when the taxation on sugar sweetened beverages was introduced. So basically we are saying is that in addition to making sure people are seeking health services, are wanting to know their status, there is also a very firm legislative initiative to be able to address commercial determinants. So we would be looking now at evaluating the impact of the salt regulation, which was phased over 2016 and 2019. And we were hoping that we will do this together with people like the Salt Watch and the Hypertension Society.
All right. Okay, we'll come back to you just now. Let's just come back to you, Dr. Mayayise. Why should we worry about hypertension? I mean, if there are so many people walking around with, not knowing that they have hypertension, what are the clinical features and what can possibly go wrong in the body?
Okay, so hypertension is basically you've got a pressure that is now too high for your blood vessels and your heart to handle.
Right.
So what happens is the blood vessels can end up giving problems later on. And then the problems, it depends on which one shows up first. If you got one in the brain showing up, then you get a stroke. If you get one showing up in the heart, you get your heart disease, you get your heart failures, you get your coronary artery disease, you can get heart attacks, you can die. You get it once you're in the kidneys, you get kidney failures. You get one in the legs, then they chop off your legs. So we will all know one or two people who've got this thing. So that is the problem with blood pressure. So now the issue is it's what is called a silent killer. So the blood pressure is going to be doing damage all along, and then without you being aware of. Hence, we've got the statistics of awareness. It's not surprising. You are not aware that this damage is going on until when the bomb explodes. By that time, we say, no, the time bomb was ticking all along. So that is the problem. So that's why we need to be aware, because if you come with any of these conditions that I've said, we're going to do something to help you, but you came a bit too late. What we are trying to achieve and what we would like is for you to be able to pick it up before it starts causing problems, control it then so that we avoid these problems.
So essentially what you're saying is that there may not be any symptoms.
Yes.
The only time you'll get symptoms is when things have gone wrong.
Yes.
All right. We're going to come back to that time for a quick commercial break. When we come back, we'll continue our discussion on hypertension. Please stay with us.
Solani Mkiva says that they believe that the king should be released and that they are not being opportunistic.
The last 4 years, we have been engaging with government. It cannot be a post-colonial government that begins to jail a king in a context of what actually happened.
Bobby Solomons, he's the spokesperson of the Alex Shutdown Committee, the multi-billion rand Alexander Renewal Project. Nothing came of that.
Community wants to know what really happened to the money.
The creative director of the label, Mansu, that of course means black is beautiful in Sesotho. What has been your experience in that regard, given some of the more established labels that you have managed to work with?
It is hard. 15 years is a long time. There's a lot of sacrifice for your family to make for you.
This is the thing. This is it this morning.
The SABC News mobile app is your one-stop digital portal to all the news you need. Stay connected with the latest in breaking news. Watch the SABC News channel along with clips and live streams of all the big news events. And listen to all the SABC News radio stations live, including podcasts and much more. Simply download the SABC News app to your Android or iOS device from either the Play Store or the App Store. SABC News, independent, impartial.
Welcome back. We're talking hypertension with our guest, Dr. Mayayise, who's a cardiologist, Dr. Mpe, who's also a cardiologist, by the way, but from this time representing the South African Hypertension Society. And in our Pretoria studios, we'll have Singh, who's the director for NCDs from the National Department of Health. Now, let's come back to you, Dr. Mayayise. Who's likely to get hypertension?
Who's likely to get... So, the person who's got a family history of hypertension, you are likely to get it. And then also the older you are, the more the systems that regulate the blood pressure and so on gets tired, and then the more likely you are to get it. And then the other one is the lifestyle. It's a lifestyle disease. So the people who tend to be overweight or obese, they tend to become hypertensive much earlier. That's why you find that there's a rise even in young kids. As young as 10, 15, you've got an increase in hypertensive in those. And part of it's mainly the rise of obesity that is coming along with the rise in hypertension.
So one might ask then, do we know what causes hypertension?
We would like to know, because if we knew exactly we were going to deal with the cause. But 95% of them, they actually are not known. So we know there is a contribution of lifestyle, contribution of environmental factors, and those ones.
Yeah.
And then there's only 5% which is known, so which is what we call secondary hypertension. So there are conditions that are seen mainly by our pediatric colleagues, which has to do with genetics, and then there are syndromes that are associated with that. And then on our secondary part, we've got patients who develop a kidney disease. Kidney is very important for regulation of blood pressure. So once you start getting kidney disease, you're likely to get hypertension. And then we've got endocrine problems, all right, if you've got a problem like your thyroid problems, you are likely to get hypertension. You know,
Right.
and yeah.
Okay, let's take Tumi on the line from Johannesburg. Tumi, welcome.
Hi, good morning.
Good morning, sir.
Man, I just wanted to check.
Yeah.
It's been, what's today, Wednesday, Monday, Tuesday. I've been having consistent headaches from Monday until today. I just decided to check my blood pressure.
Right.
I think about 2 hours ago it was 146/99, right?
Okay.
I woke up, I think about 30 minutes ago, I checked it again, it says 148/101.
Right.
What is wrong with it?
Okay, let's give it to the experts. Let's give it to Dr. Mbe.
Yeah, thanks for the question. That's a good question. A lot of people want to believe that high blood pressure causes headache. But then if you've got pain from any source, the blood pressure will go up. That is why even when you want to get a true measurement of blood pressure, you shouldn't do it when you are under distress. Even the way we do blood pressure measurements the correct way, people should be rested and so forth. But if you are unwell, the numbers that you get are unlikely not to be representative of your true pressure. Like even when you exercise, your blood pressure will go up. That's a normal physiological response.
Right.
So blood pressure ranges 140 to 160. That would be mild hypertension. And also the correct way of blood pressure measurement is something that we advocate. Like whatever instrument you are using, whether it's accredited, and whether the technique that you use is proper, and whether you rest enough before you do the measurement, whether you have had coffee before, whether you have had a meal and so forth. So there are many other circumstances that can alter those numbers.
So what should he do then? And I guess coming back to the issue of, what equipment you're using, whether or not it's accredited, I'm sure a lot of people out there wouldn't know which, instrument to use. What should people do?
Yeah, that's the objective of the South African Hypertension Society, to embark on education as well on the equipment to use. We know there are lots of applications these days which can measure the blood pressure, but because they are not validated, we do not know whether those numbers are accurate or not. And the risk the blood pressure devices we discourage people from using because they tend to give false readings. So the device that is recommended is the one that measures on the arm because it's closer to the heart. Having said that, on the market there are lots of instruments that are not necessarily validated and which are very inaccurate. So we are trying as the Hypertension Society to identify what the international norms are and what equipments are there. And we'll try and populate a list of what is available in the country and put it on the website.
Right.
But the easiest that people can do when you go buy the equipment, you must check on the box. So those that are accredited, some of them will have the British Hypertension Society endorsement or American and so forth. So the fact that you've got a device does not necessarily mean that the pressures that you are measuring are good. Remember that the blood pressure reading is key in this case. We need to know the number because we base our treatment decisions on that.
Right.
So for the gentleman who just asked the question, I wouldn't worry much about those numbers.
Okay.
So we need to know why he's got the
recheck
headache,
again.
and then we can check again later.
But we cannot ignore his headache either.
Yeah.
I think it's worthwhile to go and get checked out.
Right.
Yeah, you can just go visit his GP and then they have a look.
Yeah.
Yes.
All right. That's a very important one. Let's take Lizzie from Alex. Lizzie, welcome.
Hello.
Hello, Lizzie.
How are you?
We're good. How are you, Lizzie?
Yes, I just want to ask whether your blood pressure is 129/66, whereby you have been given the Pharmapress, half aspirin, and the Rejac. Is it the blood pressure fine, or whereby you have to decrease the triplet?
All right. I'm sure they've heard the question. Thank you very much for the question. Let's ask the expert.
No, I'm glad this question actually came because we deal a lot more with these problems,
Right.
Where my blood pressure was high, I took treatment. Now they said the numbers are fine. Why should I continue taking treatment? Because this is what the question is basically.
Excellent question.
So basically, what we want to lower the blood pressure. So now that you've taken the treatment, and then that's why the blood pressure is good for you. So we just need to maintain it there. There could be problems when the blood pressure is too low, which can lead to other problems and then so on. But if you manage to get your blood pressure there, you are taking medications. From my side, I would say please don't try to play around with drugs. Just continue taking it, measure your blood pressure. You've done well so far, and then go see your doctor. And then he's the one who's going to help you whether you need to change drugs or you don't.
Okay.
Yes.
Okay. Before we run out of time, let's go over to Pretoria and speak to Sandhya again. Sandhya, before we let you go, just from a policy perspective now, I mean, I know you've touched on issues around, salt regulations and so on, but just from a broader NCD perspective, what programs are in place? Have you got targets, awareness programs that the department is involved in and so on?
Thank you. The NCD strategy is spreadly being rewritten. The term of implementation expired at the end of 2017. And this particular strategy will inform the new targets, but it will be in line with WHO Global Action Plan targets, as well as the Sustainable Development Goal targets. We have to look at hypertension holistically because it shares the similar risk factors which are modifiable with other NCDs. And hence we've got to look at people holistically. But more importantly, we have to also look at the circumstances of people and how does government create an enabling environment for us to be able to modify behavior. So awareness programs are important. We have to get more people aware, more people screened. But the more important thing, and linked to the MMM program, is we want to see people screened and linked to care, as well as linked to ongoing support, which allows for control and adherence. So at the moment, we truly appreciate our partnerships with the Hypertension Society in moving forward, because it will address one of our important goals, and that is to look at how we improve quality of care. Not only access to be able to be screened and put on treatment and controlled, but how do we do this better? How do we train nurses to be able to take blood pressure more accurately? How do we train health workers to be able to counsel persons in terms of changing lifestyle? And while our essential medicine list was approved last year, we are in ongoing discussions to make sure that South Africa has medicines which are the appropriate to all persons in the country.
Okay, Sandhya, I know that your time is limited, but thank you so much for contributing to this show. And yes, all the best for the future. And time for a quick break, gents, ladies, young ones. And we're back to you soon after this. Thank you.
The SABC News mobile app is your one-stop digital portal to all the news you need. Stay connected with the latest in breaking news. Watch the SABC News channel along with clips and live streams of all the big news events. And listen to all the SABC News radio stations live, including podcasts and much more. Simply download the SABC News app to your Android or iOS device from either the Play Store or the App Store. SABC News, independent, impartial.
Okay, thank you so much for staying with us. If you just joined us, we're talking hypertension with our guest, Dr. Mayayise, who's a cardiologist based in Pretoria. Dr. Mpe, also a cardiologist, but is president and advisory board member of the South African Hypertension Society. And we're now joined by another special guest, Nosipho Msiza. Nosipho is somebody who's been living with hypertension for quite some time, and she'll tell us about it. Welcome to Health Talk, Nosipho.
Thank you for having me, Doctor.
All right. Before we start our discussions, let's take two callers. We'll take them one after the other. First is Santae from Pretoria. Santae, welcome.
you.
Hello, Santae.
Good morning.
Morning.
Can you hear me?
Yes, we can, loud and clear. Go ahead.
I have a question for the doctors.
Yes.
My son is struggling with hypertension since he was 17 years old.
Right.
And the doctors cannot determine what is wrong with him. They've done several tests, including Dopplers, heart sonas, and everything.
Okay.
Currently, he's using 3 different medications to lower his blood pressure, and still sometimes his blood pressure peaks to up to 134, 94. I just need to know what can be the cause of that, because he's a slender child, not overeating, overindulging, using spicy foods, using over-excess sugar. So what can be the cause of that?
All right. Thank you so much for the question. It's quite clear. You don't need to ask any further questions. Eh?
Yeah.
All right. Let's take Thabang. Thank you. We'll come back to you, Santae. Let's take Thabang from the Vaal. Thabang, welcome.
Thank you.
Welcome, Thabang.
Hello?
Yes, sir.
Yes, Thabang here.
Right.
I just have a quick question for you, man. What happens when you're taking treatment for your high blood pressure?
Yeah.
And then suddenly it becomes normal? When do you stop taking treatment? Do you continue with the treatment, or what happens here in that instance?
All right. Thank you so much for that excellent question. It's quite similar to the other one, but okay, let's give it to the experts first.
Okay, I'll take the second one.
Okay.
So yeah, this is a follow-up from the first question. So if you are on an antihypertensive treatment, then your blood pressure becomes controlled. So what it means that your treatment is working.
Right.
So you continue taking it. And then if the blood pressure becomes too low or it becomes too harmful for you, then there's adjustments that need to be made. But it doesn't necessarily mean that your blood pressure has been cured. There are things which can change, like if somebody is obese, they kind of lose weight, and then they get physically active and so on, then blood pressure control can be better. And then, but it's still better done with your doctor, together with your doctor, rather than you saying, look, I had the doctor, I saw the reading, and then therefore I'm stopping. That is the wrong way to go about it.
So the key word is that it's controlled and not necessarily cured.
Yes.
Dr. Mbe, the 17-year-old...
Yeah, on the 17-year-old, I think it's unfortunate that he's struggling with high blood pressure at such a young age. The old teaching used to be that if anybody had high blood pressure below the age of 35, you'd look for secondary causes, like my colleague has explained earlier on, where you have a cause. Because above 35 would accept the majority, you wouldn't necessarily find a cause where there's interaction between the environment and your genetic makeup. And these days we see the essential type of hypertension where there's no identifiable cause even occurring in younger individuals. So in this 17-year-old who's living with high blood pressure, where all investigations drew a blank, the unfortunate thing is that he has to stay on medication.
Okay.
And the reason he's on 3 different pills is because the reasons why the blood pressure goes up is multifactorial, so we don't know the mechanism in an individual. So you target different mechanisms, and these 3 pills have different mechanisms of action.
Okay.
So if it creeps up to around 135 and so forth, I wouldn't really panic.
Yeah.
And the other problem is that we shouldn't be measuring blood pressure too often, because the more you measure it too often, also that induces anxiety and
What
the
is
blood
too
pressure.
often?
Like you do the blood pressure every day.
Okay.
You know, once it's stabilized, monthly measurements should be fine.
Right.
Unless there's a reason you want to check it out of 10.
All right. Let's speak to Nosipho. Nosipho, you have a wonderful story for us. I believe that you were diagnosed with hypertension some years ago. When were you first diagnosed with hypertension?
I was diagnosed with hypertension in 2016.
Right.
Yeah, early. I think it was February or March, if I'm not mistaken.
Yeah.
I was diagnosed with hypertension. I remember vividly, the sister said to me, she asked me a lot of questions.
Yeah.
My age, if I'm married, do I have kids?
Right.
And I said to her, no, I'm not married, I don't have kids. And then she said to me, you know what, you need to start medication. You need to start medication
Right.
because you are a high risk of attracting stroke and your cholesterol level is too high. So you need to do something about your weight. But now I'm going to give you medication. And I said to her, you know what? I don't mean to undermine your profession or anything, but this is my body. I live in this body. Can you give me a grace of 3 months, just 3 months? And then if I come back here, then the numbers are still the same, then I'll be definitely on the medication. But for now, just give me the grace of the 3 months. Okay. Then I want to do something. I want to make good life changes, you know. So, and then she did it.
So what life changes did you then do?
I started by walking.
Right.
It was difficult because I was extremely obese. I was weighing 113 kilograms, wearing size 50. So I was extremely obese and leading a very unhealthy lifestyle. So that was the wake-up call for me, a harsh wake-up call. So I slowly but surely, I started by walking, and then it grew gradually to jogging, to attending park runs, discam runs, you know. So it just grew from there, and making smart dietary choices, my nutrition, my eating plan. Now I had to plan what I eat and eat what I have planned.
I'd like us to go a little deeper into your nutrition plan, because the physical activity is quite clear that you became more regularly active.
Yes.
And you enjoyed basically what it is that you do. You started by walking and, you know, park runs and so on. But before that, let's just speak to Sarah quickly from Kroonstad. Sarah, welcome. Sarah, are you there?
Yes, I'm there. Hello.
Hi, Sarah.
Yes, I just wanted to ask a question. My mother is currently on medication for high blood pressure.
Right.
And she tested 2 days ago, and it's still very high because the last reading was 230 over 130. And she said she doesn't have any side effects or anything. What can be the causes of that and the risks involved?
All right. Excellent question.
Okay. So
thank you.
This goes into what is called resistant hypertension. So I think some of the factors that we look at is a question like the setting where the blood pressure is done. So like if she has consulted before, the blood pressure is high, and then she's coming back for recheck. So anxiety can creep in there. Then you might end up having with what is called a white coat hypertension.
Yeah.
So now when you walk into the doctor's room, the blood pressure shoots up. And then we might end up over treating somebody because of that reason. You know, then the other issue is if somebody is getting older, complications can creep in. One of the complications which makes it difficult to control blood pressure, if the blood vessels that take blood into the kidneys, if it can narrow down, control of blood pressure becomes a little bit too tricky, and then complications like pulmonary edema becomes a little bit more common. So I think the measurement of blood pressure should be something that we look into very, very carefully, that somebody is relaxed. If they have got high blood pressure, do we sit them down, and then after 5 minutes, 10 minutes, repeat the blood pressure and make sure that we have done the right techniques before we start just looking at the number and just acting, because we might end up causing harm in that way.
I guess in the next segment, when we talk treatment, I'd like us to focus on treatment for the elderly.
Yeah.
Because, you know, the numbers that you mentioned, I mean, you know, are quite high. But I remember the practical thing is, what does she do? What does the mother do?
Yeah, and I'm glad she's mentioning that she doesn't have problems, but the blood pressure is so high, which is what we've been saying, that is a silent killer. Right. The numbers will creep up, you won't feel anything. It's only when you measure. Yeah. But then the other things that people may be on treatment on paper. The other things we need to look at is compliance, whether or not they're taking medication. Right. And in some instances, the treatment may not be enough. It may need to be increased. And then also lifestyle modification is always adjunctive to drug therapy. Okay. Has she cut down on salt, you know, the lifestyle changes that we're talking about. So some people believe that because you are popping pills, you don't have to change anything you do. Right. So there's a lot we need to look at, and also to exclude complications like kidney problems, which can actually lead to difficulties in controlling the blood pressure. Okay. So the first step to take now is to go to a doctor, who will then revise the medication, do a few basic investigations to make sure there are no complications, and try and adjust the medications appropriately. Maybe more pills may need to be added, or the doses of the treatments that she's using now may need to be adjusted.
All right.
And then also, we must never forget the other tablets that you could be on. The older they get, arthritis and those kind of things tend to creep in. And some of the medications that we use to treat the other, they tend to push the blood pressure up. So we need to look at the patient holistically. So if you are going to see the doctor, go with everything that you have. that they can be able to see the whole thing. Because sometimes you might be missing something that it's actually very easy to deal with.
Okay. Nosipho, I want us to continue your story, but after the break, okay? Well, time for another break, and when we come back, we'll wrap up our discussion on hypertension and look at treatment. Please stay with us.
As part of Africa, we're giving its people the great future it deserves with an investment partner like no other, you. We've invested 120 billion rands of our money and yours into creating more than just hope for this beautiful continent we call home. We're sustaining our soil and enriching lives. We're giving our children a brighter tomorrow. We're investing in small businesses to grow the economy. And we're bringing warmth and light to the people who need it most. And by investing in our planet, we're passing this all on to future generations too. Great things are possible when we invest together. That's why we're invested in changing Africa's tomorrow.
We're explorers. We always have been. Endlessly curious. Always looking for answers. For new frontiers. For new stories. Because that is who we are. From script to screen, from yelling action to taking you on a journey. Radio producers, script writers, on-air presenters, news reporters, sports analysts. We spend late nights creating captivating storylines and earlier mornings keeping you informed, educated, and entertained. For us, it's not a job, it's a calling. We do this and more because you do your part. SABC TV licenses, made possible by you.
Research indicates that about 45% of South African adults actually suffer from hypertension. That is a big burden, especially in a country where we don't have a lot of resources, either in our state facilities or our private facilities. So hypertension, most importantly, we need to remember, it is a lot to do with lifestyle. Making blackjack tea or herbal tea is quite an easy step. This is one of the easiest steps to actually get, or the easiest process to actually get your blackjack in. This is a nutritional powerhouse. So this packs a lot of vitamins, namely a beta-carotene. It has a lot of vitamin C, a lot of B vitamins as well. And then the most important reason why I want you to consume it is it has fiber, especially in the country where we are burdened with chronic lifestyle diseases. Fiber is great because fiber is great for diabetics because it keeps you fuller for longer, and it also helps your insulin as well. It's also great for hypertensives as well. It also has protective factors. So cardioprotective factors is mostly for your heart. You're going to need a cup of blackjack if they're fresh. If they're not fresh, you're going to need about 2 tablespoons. So that's dehydrated or dry blackjack leaves. About 1 liter of water, filtered water if you can. Put the liter of the water together with the leaves. Let it come to a boil, and then use a strain to strain it out. That's it. Enjoy tea.
All right, welcome back. We're with our special guests, Dr. Mayayise and Dr. Mbe, and I'd like you both gentlemen to give me your comments on the clip we've just played, because I think this plays quite a major role in our society, whether or not drinking tea has any role to play in the control of hypertension or other supplements. But before we start our discussion, of course, we also have Nosipho Msiza, who is living with hypertension as part of our panel today, sharing her story with us. Now let's take Akhona from Ekurhuleni. Akhona, welcome.
Hi, thank you. How are you?
We're good. How are you, Akhona?
I'm great, thank you. May I please ask?
Yeah.
I'm currently weighing 126 years, and I feel dizzy like every morning. I've tested pregnancy. I'm not pregnant. I've went to the clinic. My BP is normal. No low blood pressure. So I wanted to ask, what could be the cause of that? Because they've also tested hypertension, nothing.
Okay. Good question. Not an easy one, but let's give it to the doctors, yeah?
No, I think there are other complications outside high blood pressure of the hypertension. On my side, as a heart specialist, I mean, like if you're struggling to breathe, and then you're wheezy for no reason, and those things, I would be concerned about the heart. That's the first thing, and then there could be other issues. You know, like you can have asthma, you can have other diseases that can cause this breathing issue. And then it doesn't necessarily have to be that like the high blood pressure only.
Okay.
So
she mentioned she weighs over 100 kilograms as well.
Yeah, obesity in itself, I'm not sure how tall she is, but she has to be very tall to be lean with that weight.
Yeah.
But then obesity has its own problems. So when we talk about management of obesity and its complications, you can have clots in the legs which can go into the lungs. You know, you can have sleep apnea and so on. There are many problems that can be associated with obesity.
Yeah.
So now that we're discussing hypertension, we're not necessarily discussing a condition which will give answer to all the problems. So we're not necessarily saying hypertension is the only condition which is out there. And even when we discuss the management, I'm sure people will appreciate that we do individualization of approach.
Yeah.
That in an individual with high blood pressure, they may have other issues other than blood pressure elevation. For instance, some may be diabetic, some may have problems with smoking.
Let's carry on that. I mean, what are the principles of treatment for hypertension before we get to Nosipho?
Yeah, the principles of treatment, we look at the blood pressure reading.
Yeah.
So we categorize according to the severity of blood pressure elevation. That would put you in one group or another. And then we look at the presence and extent of other risk factors which can lead to the same complications, like the presence of diabetes, those who smoke, you know, high cholesterol, those who are obese, the ones with a bad family history. And then we also look at whether the high blood pressure at the time is already complicated or not. You know, like we look at the eyes to see if there are eye changes. We look at the heart, whether there's already thickening of the vessels of the heart, whether there's already protein in the urine and so forth. And then from there, we look at other associated clinical conditions which may actually coexist and not necessarily be from the hypertension. Like people may have suffered a stroke before, some may have kidney problems, some may be in heart failure and so forth. So when we decide on which therapy to give, we check whether the person has high blood pressure without complications, or we've got high blood pressure which is established, or there's high blood pressure with associated clinical conditions. So the choice of therapy will be determined by the summation of all these considerations in an individual. That is why we do not advise people to share medication.
Right. Individualized.
And also, in addition to medical therapy, lifestyle modification is a must.
Right.
Yes, you don't take medication and then you don't exercise, you don't eat healthy, you don't look after yourself, basically.
Well, talk about lifestyle modification. Here's Nosipho to tell us more about, you know, what she's done for her nutrition in particular.
Yes, breakfast is the most important meal of the day, and portion control is very important. And as a person, I think 3 liters of water per day is good, but not at one go. You know, you will break it down for yourself. So I did that for myself. I had snacks on my bag, but healthy snacks, like your fruit, banana. Banana lowers high blood pressure. The doctors will testify on my behalf. Almond nuts, they also lower high blood pressure as well. So I had those snacks in my bag now. Every time, everywhere I go, and water, and vegetables. I ate a lot of vegetables, less meat, less salt, less sugar, less spices. I don't need to name them.
Right.
And she doesn't smoke cigarettes.
She doesn't smoke. She doesn't take.
Okay.
I don't.
All right. Okay. I'd like us to get back to that clip. Just before, I mean, the role of alcohol.
Yeah, alcohol in moderation should not be a problem. So for females, we recommend 1 standard serving per day. For men, we recommend 2 standard servings per day.
Yeah, what's the standard serving, brother?
So the amount of alcohol you'll have in a can of beer, 4.55%, 330 mils, 340 mils will be 1 standard serving.
Yeah.
If it's wine, about 150 mils, which is your standard wine glass. If it's gin brandy, because the alcohol concentration is much higher, 45%, 2 plus 50, 1 tot would be equivalent to 1 alcohol serving. So the difference here is just the dilution.
Okay.
And also that if we say 1 per day for women, we do not necessarily mean that they should abstain for the week and then count the ones for each day and say on a Saturday, then they can have 5. Yeah. So if you consume, that saving is per day regardless of whether one was drinking the day before or not.
Right. Let's get back to that clip.
Yes.
The role of supplements, natural herbs, and all sorts of other supplements. Perhaps let's comment about that one. I don't know, I must confess, I don't know much about blackjack tea.
I will also say I don't know much about it. From my side, I think we normally are gonna, in clinical practice, we will see patients who've already got damage from high blood pressure and stuff, and then we would like to stop that damage. So from the work that is done by Hypertension Society, which Dr. Martin Pempe is part of, they actually look at the science behind the hypertension, the treatment, what works, what doesn't, and so on. So now, when we recommend, we have to go by that, that this drug is best for this condition, for this person, based on 1, 2, 3 on the evaluation. So that's how we normally going to arrive at that. In terms of supplement, which ones I can recommend and how they must take it and stuff, I don't really have much information as far as that, and I wouldn't necessarily recommend that they become a substitution, that I was taking blood pressure medication, but now I've switched to this supplement. It's not something that I would recommend.
Dr. Mpe, a lot is written about these things on the internet, everywhere. I mean, how much do we know about them? You know about, at least I've heard recently about one called Moringa oleifera. How much do we know about these?
Yeah, the problem with most of these, they may contain what is purported to be in there, but then the problem is that if you do not have controlled clinical trials for somebody with a scientific background, it becomes difficult to advocate for them or even against them for that matter. All that we say to people is that they should know their numbers, blood sugar, blood pressure, and so forth. And if whatever you are using is working, we'll see the numbers changing in the right direction. Because even with diet, we may argue that one should have high protein diet or low protein diet, high cholesterol and so on. But all we know is that when it comes to diet, energy in and then energy out, you need a balance. If there's more in than what goes out, you put on weight. If there's less in than what goes out, you lose weight. And then I like the principles really on dietary modification. We say less salt, less fat, less sugar. And sugar here we're referring to refined carbohydrates.
Right.
And then from there people must exercise. And I think that would sum up the lifestyle modification in a nutshell. Yeah.
Just before we run out of time, in fact we have run out of time, but just quickly, Nosipho, you have, your blood pressure is now controlled.
Yes,
You're not on any medication.
No, I'm not.
Simply because of your lifestyle modification.
Yes.
Well, I wanted to thank you so much, and I think you're a very bright example of what it means to just modify your lifestyle to effect that kind of change. I'm afraid that's all we have time for today. I want to thank you very much for your contribution. And for you folk at home, thank you so much for watching this, and I'm sure you've learned a lot, as much as we did. We see you again next week, same time on SABC. I'm Dr. Silo Mutawang, and until then, please do take care.